Hello everyone, this is Dr. Chris Reising from the St. Alphonsus Esophageal Health and Reflux Center. Today I'm going to be teaching you about a procedure called manometry. So what is manometry? Well, manometry is an outpatient procedure performed in our office that measures the coordination of contractions and pressures of the esophagus when we swallow. Well, who should have manometry? First, let me teach you about the esophagus. The esophagus is a muscular tube connecting your throat and stomach. The muscles of the esophagus squeeze in a coordinated sequence that moves food and liquid into the stomach when you swallow. Motility disorders of the esophagus can occur when the pressure or coordination of esophageal muscular contractions are not working correctly. We recommend manometry for patients who are planning on having anti-reflux procedures or patients with symptoms of difficulty swallowing, pain with swallowing, heartburn, chronic cough that's unexplained with other tests, and non-cardiac chest pain. Well, how is manometry performed? Well, after you arrive in our office, our nurse will put a lidocaine gel numbing medication into your nostril where the catheter will be placed in order to make the procedure more comfortable. Next, a thin, flexible manometry probe about the size of your iPhone charger cable is inserted into the nose and passed to the first part of the stomach. This catheter measures the pressures and coordination of the esophagus with wet swallows. Your nurse will give you a saline solution and applesauce to swallow during the exam. The procedure takes about 20 to 30 minutes. It's okay if you drive yourself to and from the procedure. We recommend you fast for 6 hours before the procedure, so if your procedure is early in the morning, please don't eat or drink anything after midnight. No sedation is required or recommended for this procedure because it can interfere with the results. We do recommend avoiding medications that can affect the results like opiates or narcotic medications for pain and antispasm medications. After the procedure, there are no restrictions in diet or activity. This video is a good demonstration of how a manometry procedure is performed. It will help you understand what to expect on the day of your procedure.
We are going to be doing an esophageal manometry procedure. It is a small flexible catheter, goes down one of the nostrils, down your swallowing tube, your esophagus, and sits right about the tip-top part of your stomach. It shouldn't be painful, but might be a little uncomfortable. During the procedure, you might have some gagging, some discomfort in your throat, and possibly watery eyes. Once the catheter is in place, the nurse will lie you down almost flat, will give you small sips of fluid to drink at a time. Your nurse will also instruct you when to swallow and then when not to swallow. They might also have you sit upright for some additional swallows during the procedure. If there are certain foods that trigger your symptoms, your clinician might also suggest that you bring these in. So now we are all done with the procedure. I'm going to instruct the patient about removing the catheter. So I'm going to take the tape off. What I'm going to instruct you to do is to take a deep breath in and out, and another deep breath in. And on your second deep breath in, as you hold your breath, I'm going to remove the catheter. So go ahead and take a deep breath in and release it out. Good. Another deep breath in and hold it and out.
After the procedure, we will download the information from the test to our software and analyze the data swallow by swallow. Next, a report will be generated, usually in less than a week. And as a reminder, this is a safe procedure that provides valuable information for your surgeon that can guide care decisions. This is Dr. Chris Reising from the St. Alphonsus Esophageal Health and Reflux Center. Thank you for taking your time to watch this video today to learn more about manometry. We think this will help you be more comfortable with your procedure.